Senate Majority Leader Harry Reid has vowed that he's going to get health care legislation passed by Christmas. Will he? Well, here now with more of the debate on the debate over health care legislation. Two key senators, Senator Ben Cardin, Democrat of Maryland, and Senator Gregg, Republican of New Hampshire. Senator Cardin, the president says that Congress is on the precipice of passing meaningful health care reform. Do you agree?
I'm more optimistic today. I think we had a good day. The president met with the Democratic caucus members, and I think he brought more unity in our caucus. I think we are prepared to understand the underlying bill is critically important to America, and health care reform. It will help make health care affordable to millions of Americans who currently don't have health insurance. It stays within the budget without increasing the deficit. I think those points have been now made very clear, and we're going to sort of realize that there's some individual issues we would like to see more progress, but this bill is critically important to get done.
Of course, one of the latest moves is that independent Senator Joe Lieberman of Connecticut effectively took out that provision that would have allowed people between the ages of 55 and 64 to buy into Medicare. Senator Gregg, are you still just as opposed to this new bill as you were before, even with that provision taken out?
Well, yes. With that, we never actually got to see that provision. That was just a trial balloon that was floated. We never saw any language at all because, quite honestly, this bill's being written in camera behind closed doors. But the bill has basic problems. It expands the size of the government, explodes the size of the government by $2.5 trillion when fully implemented, cuts Medicare by $500 billion in the first 10 years, $3 trillion over 20 years, takes that money and creates a brand new entitlement for people who aren't on Medicare, that aren't seniors, increases the cost curve of health care by $235 billion in the first 10 years, forces 17 million people out of their coverage that they presently have today onto some quasi-public plan, whatever it ends up being, and basically will end up being a plan that our country can't afford from a fiscal standpoint and will significantly, in my opinion, negatively impact the health care of a lot of American citizens. So, yes, I do continue to oppose it, and I do think the term precipice was a good choice of words, John. They're about to take us over a precipice with this bill.
Senator Cardin, Senator Gregg has just outlined what seem to be a number of problems here, particularly in a bad economy and in a time where deficits are bigger than we have seen them in any time that any of us can remember. Does he have a point?
I think Senator Gregg has described the current system. If we don't do something about it, we're going to see health care insurance premiums double in the next 10 years. We have an unsustainable system today. We've got to bring down the growth rate of health care costs. Now, the Congressional Budget Office is our objective scorekeeper. The Congressional Budget Office says for the overwhelming majority of Americans, they're going to find that they're going to have better insurance coverage that'll cover more, and their premiums will either remain the same or go down. It also says that we're going to put 31 million more Americans who currently don't have health insurance are going to have health insurance. And they also say we're going to do it by reducing the federal deficit. Now, that's the Congressional Budget Office. Now, we all can interpret this. But the point is that health care is not static. It's going to change. And if we don't do anything, the status quo means that health care is going to become more unaffordable for more and more Americans. More small businesses are going to lose their coverage. More Americans are going to be paying more and more of their income for health care. We've got to do something to change the system to make it affordable to all Americans.
There seems to be little question,
course,
Senator Cardin. Sorry, I was just going to say that there seems to be little question, Senator Cardin, that there are a lot of problems with the health care system, particularly in terms of the number of people who are insured here. What would you do differently?
What would I do differently? I'm for the bill.
No. I'm sorry, Senator Gregg. Senator Gregg, what would you do differently?
Well, I actually have a proposal which I think would accomplish much of what needs to be done without this massive expansion in the size of government. Let me give you 4 or 5 points of it. First, I would address abusive lawsuits and reduce the cost that they drive up in the system. Right. Defensive medicine's about $250 billion.
That doesn't take care of the whole problem, though.
No, but you can't do this in a massive attempt. That's the problem here. When you cut Medicare by $500 billion over the first 10 years and take that to create a new entitlement, which is going to cost $2.5 trillion, you basically put in place, locked in place a government growth process here, which is unsustainable and which is inevitably going to significantly impact seniors and basically put us in a position where we will not be able to afford the health care system that's being put on the books. They're talking about an explosion here of the size of government. And, this idea that you bend the cost curve, their own actuary, the government's actuary said that's not what happens. It increases health care spending. So I'll give you 4 or 5 points if you've got time. They're starting with the abusive lawsuits, which would bend the out-year health care issue, cost issue. And further, if you want to insure everyone, you shouldn't put everybody under a massive new insurance program, which basically requires people to buy insurance they don't need or forces them off the their private plan, which they happen to enjoy. What you should do instead is create different types of insurance products for people in different types of situations. For example, people between the ages of 20 and 40, they ought to be able to buy a catastrophic plan, or should be required basically to buy a catastrophic plan, which would essentially insure them if they get into a serious accident or they have a serious health care event, so the rest of the country or the rest of the community doesn't have to support them. That does not require nationalization of the system or this explosive growth in the size of the government. That can be done at reasonable cost. So you do a step-by-step approach to this issue, and you resolve the issues that you can resolve in an effective way, rather than basically creating this incredible and extraordinary expansion in government at the expense of Medicare and at the expense of the American taxpayer, and especially small business.
Senator Cardin, do you want to respond to that, particularly on this point that Senator Gregg made about that this would force people out of the health care plans that they enjoy now?
People have health insurance that they like today through their employers, or they have the plans, they're going to be able to keep those plans. And there's a better chance that those benefits will be expanded rather than contracted. And the employer now is pushing more and more of the cost onto the employees. Let me just give you the circumstance in Maryland, which is similar to most states. 71% of the people that have private insurance in Maryland are in one of two companies. We don't have enough competition today. These exchanges that we put into the law will offer more choice to small businesses and individuals, so they'll be able to find an affordable plan. They'll have more choice to have the type of plan that they want. Today, small businesses have virtually no choice of what type of insurance they can get.
Well, of course, John, that's not what the president's actuary said. His letter came out this week. It said
the
very
Congressional Budget
specifically,
Office says it.
You know, if you don't believe your own actuary, fine. But your own actuary said, and that's the CMS actuary, who is the specialist in this area, said 17 million people would lose their private insurance. It also said that health care would go up, premiums would go up. It also said that Medicare recipients would find that 20% of the Medicare providers, that's the hospitals, the doctors, would not be able to continue to practice because of the cuts which would be incurred as a result of this $500 billion cut in Medicare. And therefore, there'd be less providers available for seniors, and you'd find that seniors don't get as good a care as they're getting today. These were actuarial findings by the senators, not the senators, but by the president's actuary, the CMS actuary. That's the facts.
It's just,
Senator Cardin, final word to you, because we started with Senator Gregg. Go ahead.
The Congressional Budget Office is the objective scorekeeper. And the Congressional Budget Office says that the insurance premiums are going to go down for an overwhelming majority of Americans. That's the facts. And the actuaries say that we're going to extend the life of Medicare for 10 years. That's the facts. Let's take a look at it.
No, that's not what the actuary said, Ben. You know that's not what the actuary said. What the actuary said was that you can only do that if you don't create a brand new entitlement. They said when you put this major new entitlement in place,
what
actually
new entitlement
you will
in Medicare? There's no new entitlement.
That's not a Medicare entitlement. You're taking Medicare funds and you're funding the brand new entitlement for people who don't have insurance today, and it's a massive entitlement. It's a $2.5 trillion expenditure.
Gentlemen,
and they made it very clear you couldn't afford that, and it would affect Medicare solvency.
Gentlemen, I hate to use these words, but we are going to have to leave it there. And Senator Gregg, you are correct. We started with Senator Cardin, so you got the last word in there. Appreciate it. Thanks for joining us tonight.
Thanks for the fairness.
All right. You could call it